I'm saying it works.
Patients preferred it.
Because they're looking for a new alternative.
In 2006, it came about because I had several patients and accumulating a number of patients who simply could not do the preparation.
Everybody complains about this prep. It's not a lot of fun, but you know, the goal in what we're doing is we want to see the inside of your colon.
I've seen many times where the oral bowel preps will actually create a type of colitis in the colon.
5 to 10 times a year, I come across a patient that can have a very adverse reaction to Dulcolax, where they get severe abdominal cramps, pallor, near fainting episodes, okay, tachycardia, where their heart races, almost to the point that they're considering to call 911.
It just so happened we were having a series of cancellations at least once a week, which may not sound a lot to you, but that's a lot of patients not coming in.
I took about 150 people, and I did 50 people with hydrotherapy, 50 people with fleets. What we found in that study was that the hydrotherapy worked quite well. We got good to excellent preps in most patients. It was comparable in efficacy to the fleets and the cholite. Looking at whether or not the hydrotherapy affects people's electrolytes, it does not. Patients preferred it.
If you look at the ASGE recommendations, or what they consider adequate alternatives for bowel prep, believe it or not, the colon hydrotherapy is in there as an adequate recommended means of prepping the bowel for colonoscopy.
From my experience, I would say a couple of important things. The preps were just as good, or if not better. Patient satisfaction was much higher, okay, and the side effects were less.
We just advertised one time in the newspaper, and all of a sudden we were booked for 6 weeks in advance. We've had some people from New York come here because they knew we had the hydro prep. We have people that find us on the internet because they're looking for new alternatives.
I have people coming from actually Westchester, from New Jersey, from Manhattan, because I offer this type of a prep. My patients are very satisfied. Those patients that have had both preps before, the oral prep and my colon lavage prep, every single one preferred the colon lavage. Every single one. Our
patient satisfaction is super high, in the 90s on all of the questions that we ask, and people, they want it.
We have found that it is an effective tool, an effective way to prepare for colonoscopy. Most of the patients who have hydrotherapy, when they come back again, ask for the hydrotherapy.